The Canadian Red Cross Society is a Canadian humanitarian charitable organization, and one of 192 National Red Cross and Red Crescent societies. The organization receives funding from both private donations and from Canadian government departments. The Canadian Red Cross trains volunteers in emergency response, disaster response, and disaster assistance, and provides injury prevention services such as outdoor activities, safety and first aid training. The Society, through the international network of the Red Cross, helps the world's vulnerable populations, including victims of armed conflicts and communities destroyed by disasters. The current Secretary General and Chief Executive Officer of the Canadian Red Cross is Conrad Sauve. The Canadian Red Cross was established in the fall of 1896 as an affiliate of the British Red Cross Society. George Ryerson, who had founded Canada's St. John Ambulance Association in 1895, spearheaded the organization's founding. The Canadian Red Cross Society Act legally established the Red Cross as the corporate body in Canada responsible for providing volunteer aid in accordance with the Geneva Conventions. The first international activity of the Canadian Red Cross was treating the sick and wounded in South Africa during the Boer War. After the end of World War I in 1918, the society began training public health nurses, a children's program designed to promote healthy living. The Junior Red Cross was set up in schools across Canada. For many years, the Canadian Red Cross was responsible for collecting human blood from donors for medical use. The Ottawa branch of Canadian Blood Services operated from a building on Metcalfe Street which was donated by Mary Alice Danner in memory of Flight Sergeant William Dewey Hagyard RCAF, who was missing in action in World War II. The branch later relocated to Plymouth Street. In 1988, after serious flaws in the blood collection process were uncovered, the society stopped providing this service. The Canadian Red Cross had its centennial celebration in May 2009. In 2017, the Red Cross provided food, shelter and medicine to asylum seekers crossing the border into Canada from the United States. The Canadian Red Cross provides assistance to Canadians experiencing an emergency or disaster. The organization works in partnership with government, first responders, emergency management, and other organizations to support their response activities. They also provide assistance for people's basic needs, which includes family reunification, lodging, reception and information, food, clothing, and personal services, such as first aid, temporary care for children or elderly, and other support. The Canadian Red Cross offers a range of community support services that provide daily supports to older adults, vulnerable people, and their caregivers. The goal of these programs is to provide support in maintaining quality of life, independence, and active participation in society. Some of the programs and services available include nutrition support programs, social inclusion programs, assisted living in supportive housing and attendant outreach services, safety programs, and transportation. The availability of these programs varies. The Red Cross also provides services to homeless people during extreme weather. This program provides health equipment to individuals dealing with illness or injury, enabling them to return home from the hospital sooner or live more independently. The program operates in British Columbia, Alberta, New Brunswick, Prince Edward Island, Nova Scotia, Newfoundland and Labrador, and the Yukon Territory. The types of assistive equipment that can be provided include wheelchairs, walkers, bath seats and benches, commodes and toilet seats, crutches and canes, bed handles, and other durable medical equipment. The program is funded through financial donations as well as through the donation of used medical equipment, diverting it from the landfill, and it carried out with the support of volunteers in the health authorities. The Canadian Red Cross offers personal support and homemaking services to support the independent living of seniors and those recovering from illness or injury. These services include personal care, home management, and respite and companion care. Home care services are available in Nova Scotia, New Brunswick, and Ontario. The Canadian Red Cross has been involved in the independent monitoring of detention facilities holding immigration detainees since 1999. Following a request from Citizenship and Immigration Canada, The organization provides independent monitoring to determine if detainees are treated humanely and their human rights and inherent dignity are respected. As of 2014, this includes visiting federal immigration holding facilities and some provincial correctional facilities in Quebec, Ontario, Alberta, British Columbia, and Manitoba. The Canadian Red Cross is involved in treating the wounded on the fields of war and